Okay, so again, just similar to the cervical spine, people flex thousands of times a day. Chances are you're going to have flexion may be painful, and if you have a derangement that is posterolaterally enough, flexion might be painful, but sometimes it's not limited at all. Sometimes only flexion blocks extension, as in you can flex all you want, but you still know it's a derangement because if flexion limits extension, and then you do extension after extension after extension, and then you improve it back to normal, then you do 10 more flexions, and all of a sudden your extension is blocked again, you still know that there's a derangement there because you can quickly lose the motion as fast as you can improve it. So it's one of those things that even in fellowship, Dr. Schenk asked me twice, once on my first day, and once a couple days later, or a couple months later, what is more important? Is it more important if I had a severe loss of extension to keep my hips on the table, or to extend my elbows all the way? Elbows and breathe out. That's right. But most people, like myself, said, oh, you got to keep your hips on the table. And I've even had a couple of Mackenzie dips say you got to keep the hips on the table. But the thought is, again, if end range is where the magic happens, and you got to go into end range extension to stretch an extension dysfunction, as in your limited extension, or you have to reduce a derangement by going into extension to reduce it, you're not going to do either one until you go to end range. So elbows extend all the way, and then tilt your head back at the end, you get a little bit more extension. It's okay if the hips, if I had tight hip flexors or limited extension, at least when I extend my elbow all the way, my hips can sag just a bit to get a little bit more extension. Ideally, for most body types, eventually you want to get it so that the hips stay down. Eventually, when the head goes back after maybe a day or so, or right away, depending on how the patient's doing, maybe they need more force right away, you can do the sag or exhale. You get a little bit more extension. So that's a progression for just any derangement that responds to straight extension. If it was more posterior lateral, that a relevant lateral component, you can do the hips offset. Instead of doing hips offset, I prefer to do what is nicknamed the roadkill. A Mackenzie diplomat and faculty member, one of his patients accidentally discovered this by saying that this helped his posterior lateral derangement. So you raise the leg on the same side as the derangement because this will still provide closing. It's a lot easier than instructing that, okay, now just lift up your pelvis and then shift over, but don't rotate. Now keep on shifting over and you bend like a banana. And you know, it's a lot easier to just say, why just lift up your leg like how a frog swims, but just lift up the leg. It hurts. So this still will provide closing. So you can maybe just start with prone, 5 minutes, elbows 5 minutes as a progression. Maybe you would start with press-ups right away. If they were somewhere between extension or prone on elbows, they couldn't quite extend without irritating it, you can try doing P to A's in this position, either unilaterally on this side or bilaterally. Then eventually you would go to extension.